A week ago, my brother got out of treatment, and 5 years ago, he was a freshman at Cambridge Isanti High School, and he started smoking cigarettes.
It's not uncommon for our kids to hit off their vape over 200 times throughout the day. They leave class, vape during passing time, on the bus, in the bathrooms, by their lockers, and in class. They admit that it's hard to stop. They are either oblivious or in denial about the negative effects it has. And it's frightening to me how consuming it is to them. It revolves around their life so much.
For them to start using at a young age, it scares me as a mom that this could impact my son and other kids as they grow and develop, and it's going to affect them for their future.
We founded a coalition in 2016, and about a year later we were looking at the Minnesota student data, and the rates the youth were smoking was off the charts and very unsettling. We have multiple community members around that table, teachers, nurses, law enforcement, county attorney's office, parents. Everyone in the community was astonished at our rates.
As the medical center, every 3 years we have to do a community health needs assessment. And one of the main priorities of our community health needs assessment was substance use in our county. With that initiative, it has come to the forefront that tobacco use in Isanti County is very high, especially with our youth. With the coalition and the role that I play in the coalition, we are able to bring this initiative together and really work together on those initiatives and be intentional to make a large impact on our community.
I think it was important for us to know that public health doesn't always have to be the leader with health and safety issues in the community, but that it's maybe as important for us to be conveners of the community around issues.
And we kind of did a heat scaling map on what type of policy would they want to engage in. Would it be limiting the amount of the flavored tobaccos, or if it would be like going to the spectrum of tobacco 21. And overwhelmingly, that's where all of our kind of heat dots landed, was on the tobacco 21 initiative. And that really gave us strong proof that our community was ready to tackle this initiative.
Today, happily, the county board voted unanimously to support tobacco 21 ordinance for our county.
T21 can keep tobacco and nicotine out of schools by creating a social gap of access. By moving the age to 21, typically those kids aren't still in school to be a supply source, whereas we do have 18-year-olds in high schools.
I'm just incredibly proud of our community, whether it was a petition signature or a letter of support, being present at meetings. I can't tell you what an honor and privilege it is to live in a community that comes together like this.